on reversing diabetes in India, a path to healthier lives. Dr. Vishal Gupta. I have the pleasure to introduce Dr. Vishal Gupta to you. After returning from the UK, having trained at the prestigious Northeast Thames London Group of Hospital, St. Bart's and Royal London NHS Trust, and securing the MRCP degree in 2007, Dr. Vishal Gupta envisioned the opening of a holistic under one roof diabetes, thyroid and endocrine center, which eventually took shape in 2014. Since then, the center services more than 14,000 patients per year, and his motto has been gifting life. In order to achieve that vision, he has led research from the forefront that has helped alter existing guidelines and treatment protocols in order to improve patient quality of life and longevity. He wrote a book called Beyond Type 2 Diabetes in 2020, which summarizes his research and understanding of diabetes, addressing difficult to manage conditions like diabetes and infections, immunity, cancer, heart and kidney disease, and most of all, nutrition. It especially guides healthcare providers to manage heart and renal complications. He founded a national international endocrine group called INDEA, Indian Diabetes Endocrine Association, that holds a yearly conference with the aim to educate primary and secondary healthcare providers on latest research and outcomes in diabetes and endocrinology. So, the floor is yours, sir, Dr. Vishal Gupta, for reversing diabetes in India, a path to healthier lives.
I'd like to thank Dr. Satya Brahma, Network 7, Dr. Mohan, my parents, my beautiful kids, my wife, and my team. Now, sorry, Dr. Mohan, I'm going to make this sound difficult. And the difficulty starts off with this primary question. So before I start, let's say if all of you got diabetes in the room and were never diabetic, what would you all choose? Diabetes reversal or ABC? I would choose ABC. I'd like a show of hands. So please, my question should be, is very specific. Each and every one in this room develops type 2 diabetes. What would you choose? Diabetes reversal, or Dr. Mohan would agree, a statin, blood pressure medication in about 40-50% of people who are just new onset diabetes, which becomes 80% over 5 to 7 years, and at least 2 diabetic drugs, one in the morning and one at night. Obviously, vitamin D replacement, vitamin B12 replacement as the bare minimum. Can I get a show of hands for, I need some help, please. We'll make this a little interactive. Yeah, please. So I have one in 7 or 1 in 8 saying diabetes reversal, and every single other person would succumb to medication. Is that right? Okay, I'll make this a little tougher. I tell all the patients, we go to Calcutta once a month and we've got this amazing patient database there. I'm so happy with the ones who are 60 plus, but so unhappy with the ones between 16 and 40. They don't come on time, they don't take their drugs, and they think they're going to live forever. Now, on that note, we have 1 in 7 or 1 in 8 who has chosen diabetes reversal, and the others that have chosen medication. Okay? So let's start the journey. I think the questions I would like to ask, right? What is diabetes reversal? And I think we as healthcare professionals are confused about that ourselves. I'll tell you what is the guideline. I'll project 2 patients because they come recently to mind amongst the many who come to us. I'm going to ask the question, is it really possible to reverse diabetes? what is the best means to do it, and can it stay reversed? And for how long would it stay reversed? Does that make sense? Yeah? So let's answer each question as we move on, right? So the first question, so in different heads, the first question, is it really possible? What do healthcare providers like Dr. Mohan, as one of our leaders in the country, initiates guidelines with international groups? What do they think diabetes reversal is? This definition evolved from 2009 to 19 to 2024. And what was the evolution? What science believes is that you be glucose-centric. What that means is you concentrate on the blood glucose. If the blood glucose comes down in the so-called safe range of below A1 of an A1C, anyone, all of you know what's an A1C, right? It's the average blood sugar that's measured over. Most people say 3 months, I say 2 months, and actually it's about 71 days, with 60% contributing 90% and 11 days is about the tail, right? So I'd say 2 to 3 months. Anybody doctors besides Dr. Mohan and myself? No. So this is an average that we use as doctors to assess what the average diabetes is. And we like to believe that once you're below a certain range, you're safe. So doctors and societies want this number to be below 6.5, and they want them to be that way for 3 months without any medication. All right? Now, I have great problems with this. And I'll tell you my problems through these 2 cases that we're going to project. Okay? And I say these 2 cases come to mind recently. I want to take you through all the numbers. Keep ABC in mind. I have a motto that we as Indian healthcare providers we start too little too late. We will use small doses very late in their therapy created by the problems of a healthcare provider and inherent inertia by the patient. I like to keep my numbers really, really low and really, really strict. So let's look at this patient. You'd all agree. So this patient, basically, we saw him in 2017. So just to cut a long story short, all of you, when you looked at these numbers, except Dr. Mohan and me, will see something really special here. You look at the cholesterols, they are way above the sort of cutoffs. I want you to keep an eye on the triglycerides. I want you to keep an eye on the creatinine. The triglyceride guideline for the world and the Americans is the cardiologists want them to be treated when they're above 200. The Diabetes Association, that's the Americans and the Europeans, say 150. I tell the Americans and the Europeans, Indians are not, we are not them, they're not us. And we recently published some papers at the American Diabetes Association just now, and we revised that number to 128, where we showed that the liver starts getting hurt above those numbers, especially when the duration of diabetes is more than 7 years. Look at the creatinine, look at the amount of protein that the patient is leaking. Dr. Mohan and I would agree that this number actually starts changing at 17.3, and guidelines say that you want them under 17. Look at the creatinine, it falls within the reference range. But this patient, when he comes to you with these numbers, is actually in trouble, right? And you can know that he's going to be in trouble. So what do we do over 1 year? Look at all his numbers. You'd say, wow, you got these numbers under great control. The lipids and the cholesterols are brilliant. I like to keep such a high. So if you look at this patient and if you try to risk factor control into major or minor risk factors, remember 2 things. When somebody is above 50 and somebody has 7 years of duration of diabetes or more, these two become major risk factors. I'm not bringing diabetes, I'm not bringing the blood pressures, I'm not bringing the cholesterols, I'm not bringing 15 other biomarkers that contribute to the risk factor profile. We showed through our research between 2019 and 2021 that despite 2 years of fantastic control with all these numbers as this patient, up to 39% of Indians have what we call as subclinical heart failure, the 4th musketeer in the cardiovascular death profile. For unfortunately, we don't have any treatment to. So you'd all agree that this patient became brilliant, okay? He returns back in 2024. So 2017 to about 18, we treated him. He disappeared from our practice. He came back in 2024. And this was about, I think, 2.5 months back. So we found out that this gentleman had joined some clinic for diabetes reversal. He joined some app, went off all his drugs, started a nutritional plan, a lifestyle plan. I'll elaborate that as we go on. Remember one thing, you can reverse diabetes as little as 6.5 days. The process of reversal starts for the glycemia, and we get this data from bariatric surgery. We get this from patients who had bariatric surgery, who've dropped 26.9% of weight over the first 1 year period. So you know that this process starts reversing in as little as 6.5 days. And I'll tell you about the direct study and its extensions and so on and so forth, which were lifestyle studies. So no carbs, lifestyle, walking, exercising, eating fruits, vegetables. His A1C came down to 6%. Would you all agree he reversed his diabetes by the guidelines? You'd all agree, right? Show of hands? All agree? Okay. So he comes to us, he gets a massive heart attack in about April. His pumping in his heart drops down to about 25%. His creatinine, look at that, goes to 1.6, and in our medical terminology, we divide the kidney, or we stage the kidney disease into 1, 2, 3A, B, 4, and 5. You really don't want to enter stage 3A and 3B because that has a direct correlation. And I tell people the kidneys, the heart, and the eyes are one, right? You got a kidney problem, you've got anywhere from a 7 to 19% of cardiac death per year, and that is massive. His pumping comes down, so his kidneys enter stage 3A disease, where the kidney functions below 60 and above 45. And you look at I was surprised by his HbA1c at just about 7.5. Would you call this diabetes reversal? Right? By definitions for healthcare society, yes. As Dr. Mohan says, there's a tiger within you. I call it Ravan within you. But that tiger within you got a hold of this gentleman 7 years down the line, even though the glycemic control came down. Now, I want to show you another case, and this patient has been under our care for 9 years. Okay? He came to us with an A1C that's really uncontrolled, and the way we figure this out is you take this number of A1C and multiply it by 27 or 29, and that's the average blood sugar you get over about 60 to 70 days. And that's quite high. Look at his blood pressures, way above the guidelines that you want. Now I've brought on, he's a male patient, he's young, he's happily married. He's got a roughly shorter duration of diabetes of less than 6 years. He has got somebody who's relatively got a lower fasting glucose, greater insulin resistance over deficiency. This is a person who you can essentially attempt to reverse. So he's happy, he's got a good stable job. You agree that over 4 years we got his BMI down from 29 to 26, so we dropped that. One of the additional benefits of dropping a BMI by about 5 points, you know that there's a 34% risk reduction of cancer associated with diabetes. Assessment, so look at his cholesterols, brilliant cholesterols. I like to target the LDL below 55. Look at his inflammatory markers. The inflammatory marker is good. ApoB is another lipid fraction I like to look at, because as many as 6 to 7 out of 10 diabetes have a greater triglyceride level, which gives you a false low LDL. So I like to look at that to make sure that this patient is really doing well and it's not a false low. Now, because he turned 50 plus, I decided to do a risk assessment. Look at his calcium score in his heart. We did what we call a CT calcium score. When that goes above 100, there's a direct association with heart disease, strokes, there's a direct association with stents, bypasses, with angioplasties. His number was 892. His wife comes for this. I see his wife for the first time in 9 years, and she comes in, looks at it, reads the number, and says, "Is my husband going to be safe?" And these are brilliant numbers we've acquired over 7 years. His triglycerides at presentation were 280, and still 9 years having lost this weight, his triglycerides are in the 150s and 60s, keep fluctuating. And we did a liver fibro scan that suggested that his liver is going to be in trouble in the next 5 to 10 years. His A1C came down to 5.5 and it's been that way for the last 4 years. Would you call this diabetes reversal? The difference is now that he is under our care. Okay? Would you call this diabetes reversal? Yes or no? Who says diabetes reversal? The definitions say diabetes reversal. Have you managed to reverse his diabetes? Answer is absolutely not. Now, reversing the blood sugars does not translate into reversing diabetes, the disease or the spectrum. It's a completely different ballgame. So my question always asks is, what are you reversing? Are you reversing age? Are you reversing genetics? We know there are lots of new epigenes that are coming in. Are you reversing the waistline, the obesity, the heart changes, the kidney changes, the inflammatory markers? Are you changing the nerves, the autonomic nerves? 1 in 3 patients have got some sort of personal interaction reduction, sexual nerves. The autonomic nerves is supplying the gut. What are you really reversing? The elevated triglycerides, what are you reversing? The liver disease. So you have to take the entire picture in mind. Don't forget, there's a reason we were asked to stay in the rooms when we were during COVID. We asked the diabetics to stay inside because you know that there was a 3-fold increased risk of mortality in them. And part of the reason was the immune system. So can diabetes be reversed? Okay, can it really be accomplished? The answer is maybe. The magic number is 15% of your body weight needs to come down. And the question is, how long can you do that? I'm going to give you data for exercise, for the surgery, and for medical therapy. But we'll start with data for lifestyle. Because every single person who comes to us wants to take lifestyle. And we had this seminal study called the DIRECT study, which was an American study. The Australians did something very similar. The Middle Easterns, Qatar did something very similar called the DIADEM 3. The look ahead looked at achieving 7% body weight in about 5,000 people. And the stop NIDDM was more a medical type of a reversal with a drug called Ecarbos that controls the flow of blood sugars. What did they find? When you dropped 5% of the body weight, there was as much as only 5% reversal. When you achieved 5 to 10% body weight, there was 29% reversal. When there was 10 to 15% body weight, there was 60% reversal. And when there was 15% and more, there was 70% reversal from the DIRECT study. Unfortunately, the large study, the look ahead, achieved only 7% of weight loss. So that didn't give us a lot of information. But we got information from heart disease. This was the phenotype that I told you. Male, younger, diabetes of less than 6 years of duration, happy, stable, greater insulin resistance, lesser fasting glucose, on fewer medications. These were the people who you could reverse. To get heart benefits, you have to have minimum 10% of weight reduction. And remember, only 1 to 2 can achieve this over a long duration of time. And I'll show you the work behind this. So, what is the best means to achieve the reversal? Again, coming down to the 3 groups. Let's talk about lifestyle. Now, I'll bring in the first and the second questions together in this. Failure to stay in remission is directly related to weight gain. Remember that. Which means it's next to impossible to keep the weight down. So the DIRECT study, when they looked at 5 years hence, what did they find? That the average weight loss between the control group and the treatment group was no different, just a kilogram. The people who were under vigilance by the general practitioners, they had a greater weight loss of about half a kilo over the control group. And when you looked at the remission, at the end of 5 years, only 10% achieved remission, which translated in 1 in 10 in this study. And this was the extension of the primary study that was done in the UK. What do we know from bariatric surgery? We know that over 12 years, when you lose 26.9% weight from two very big studies, the reversal can be achieved in as many as 50 and 30% over 12 years. And I told you this is directly related to the amount of weight that somebody gains back. So this remission reduces by 5% for the first year, up to 15% for the fifth year, going to 37% of the patients gaining as much as 25% of the body weight. Choosing the right bariatric surgery is also as important, because people who do the bypass versus people who just do a sleeve gastrectomy, that is cutting the stomach, the failure rate for the sleeve gastrectomy or cutting the stomach is 2 times as much as the bypass. But don't forget, 3 out of 1,000 is going to die. 1 in 10 are going to need some sort of support, revision or some surgery complications, and it's a very difficult or a tedious process, something that is psychologically scary too. So there is no doubt surgery over lifestyle is a clear winner. My question is medical therapy. Now, we are the first group in the world who's shown the oral semaglutide's clinical data, the British Endocrine Society, in November of 2023. And I call this class of drugs the Brahmastra or the Trishul, which is what I tell all the patients. It's next level brilliance. And I was asked to talk on semaglutide. So this was the paper. We did a great research paper. It was propensity score matching of the highest statistical analysis. And I'll tell you what we saw. We saw 71% achieving weight loss over 5%. We saw 18% achieving weight loss over 10%. We saw 12% achieving weight loss over 12%. We saw 11% who are non-responders and actually gain weight. But even in the ones who gain weight, they achieved statistical significance of inflammatory marker reduction, an independent marker of cardiovascular death. So great molecule. I think we are the first group in the world who's shown that weight loss of more than 10% was directly related to the TSH levels, which is the thyroid levels. I've always targeted my thyroid patients for a TSH of 0.3 to 0.9, and we show for the first time that if you keep the TSH below 0.9, you can actually achieve the weight loss so much easier than the other groups. And this was also true for the people who lost weight of more than 15%. Now the question is, can you sustain this weight? And coming back to my Brahmastra, which is the injectable semaglutide, popularly known as Ozempic, this was the SELECT study that looked at 41 countries, diverse populations, looked at over 17,000 people. Over 40 months, you achieved a 9.4% weight loss. Over 60 months, you got 10.2% weight loss, breaching that number. 50% reduced their BMI by a stage, and 12% reversed their BMIs to below 12. They dropped 7.7% on the waistline. The reason the 7.7% centimeters on the waistline is important, because we know from the cardiac data that for every 1%, 1 centimeter loss on the waistline, your heart benefits by 2%, and this is a huge number. So do we have sustenance data with this drug over 65 months? The answer is yes. Is there a crescendo to the weight loss over a duration of time? Answer is yes. I'll show you the third kid on the block. That is, actually there are 4 kids, 2 more kids on the block that are coming. There is rutatrutide. Look at the last column of weight loss, more than 20%. You see as much as 90%, so 60% people, 2 in 3 achieve weight loss of more than 20%. That's awesome. And I think when the oral semaglutide second generation launches in the next 6 months, it's meant to be better than the popularly known drug tirzepatide that you all know as Mounjaro, and Ozempic or Wegovy that you all know as semaglutide, and I think that's going to break the market in the next 6 months. So if I was to summarize this entire talk very quickly, what I'd say, diabetes reversal, I don't think it's possible. You can reverse hyperglycemia, not the disease. treat diabetes as two diseases, the fat that you can see in 54% of people and what you cannot see. Achieve for over 15% of weight loss, try to sustain it. You must achieve minimum 10% weight loss for heart benefits. Bariatric surgery over medical therapy. I wouldn't go down the surgical line. It's overwhelming. It's psychologically disturbing with its own problems. And I think with the advent of new drugs, there is going to be death of surgery. Thank you. This is my team, my mom, my strength, my dad, my whole team, my kids, my heartbeat. I live for them. My wife, my strength, my team without which I wouldn't be here. Thank you so much. I hope I've been able to send some message across. Happy to take any question. I hope you all don't have any.
Thank you so much for this wonderful session on reversing diabetes in India. I would now request Dr. Satya Brahma to please come on the stage to present a memento as a token of our gratitude and respect to Dr. Vishal Gupta.
Wonderful talk. I would like to call upon Padma Shri Dr. V. Mohan to join with me to give the memento to Dr. Vishal Gupta, whom he looks at as an inspiration. And he told me in the, when I called him for the speakership, when I told the name of Dr. V. Mohan, he told I would love to look at his presentation. And I thought what better moment could be, to get it like this actually. Sir, please give it to him.
Can we have a round of applause, please?